We do an extensive review of medications when an individual arrives, and we do it repeatedly throughout an individual's stay. Our experience has been that people are always on too much or too little, but not just what they need in recovery when they arrive. And it's because medications are prescribed to reduce symptoms that individuals complain of prior to coming here. Well, if those symptoms are being driven by their drug use, and the physicians that are taking care of them or the psychiatrists that are taking care of them are hearing about the symptoms that are being driven by their drug use, those symptoms have to change when you stop using drugs. And so people have been prescribed a number of things that they may no longer need when they're abstinent, or their symptoms have shifted and they may not have as many, or there may be new complexes that arise when they stop using drugs. So we review what people are on, and we try to get people on the smallest number of medications that can manage them at the lowest effective dose. And we find that people who come in with medical records that are this thick sometimes leave not being on anything when they use the tools that we provide to self-heal. They might have been prescribed a medicine because of a symptom, and that medicine produces more symptoms, and they then are prescribed more medicines to address those. But when we peel all the layers back and they engage in activities here to heal themselves, they may need very few to no medicines. Now, that doesn't mean that we're anti-medicine. We're a medically based, evidence-based program. And if a person needs medicine, they'll get them. We have a doctor who's right here who makes house calls to see people. They see him in his office, they see him at the program, and they're provided whatever it is that they need to support their recovery. But no one leaves here without the suggestion that they should have that reviewed again in 6 months, because as people gain strength in recovery, their needs for outside sources of support change, and that's to be expected.